And we're back, the second hour of GW on the Hill. Man, time goes so fast when we're having fun and talking about very relevant things. As I mentioned earlier in the show, cancer. When we talk about cancer, we're talking about something that can strike you regardless of what your economic status is, your political affiliation, how you feel about anything. You can, in fact, be a person afflicted by cancer. In this current discussion about healthcare reform, it seems that cancer treatment has been a missing element, but yet the number of individuals being diagnosed with cancer and certainly the number of individuals seeking treatment is increasing, and it seems to me that this element is a sorely missing element of the healthcare debate. So on the line with me right now is Mr. Ted O'Khan, and he's the Executive Director of the Community Oncology Alliance. And, of course, this is a group that's involved in service deliveries and certainly helping people when they get the diagnosis and they ultimately need treatment for cancer. So, Ted, welcome to the show. How are you doing?
Good, George. How are you doing this afternoon?
Very good, very good. When we talk about cancer, as I referenced earlier, it certainly strikes across the board. It can happen to anybody. But to you, when you look at this debate on healthcare reform, tell us about this missing element as far as treatment goes and what could be done perhaps to correct this wrong.
Well, part of the problem, George, is that if you look at President Obama's sort of guiding principle for healthcare reform, it's let's build on what works and fix what is broken. And the problem is that when we look at what works, cancer care works. If you look at survival rates across the world, the United States has the best cancer care delivery system in the world. And again, that's based on actual survival outcomes. The problem is that Medicare right now pays for about 50% of all cancer care, and it's broken, George, because the Medicare formula for paying for cancer care is antiquated, and it sets rates that are artificially low. So the problem is that instead of building on and ensuring that all, whether it's seniors or all Americans, get quality cancer care delivery, the problem is that we are not paying enough attention to what works in healthcare reform in terms of cancer care, and we're certainly not addressing what's broken, and that's the Medicare payment system. And again, because, George, it accounts for about 50% of all cancer care payment, it is the 800-pound gorilla in the room that influences all the private payers.
My goodness. Now, my listeners certainly want to know, just break it down, if you will, Ted. Now, so if this service is provided, one is getting treated, and then the providers are absorbing a lot of this expense, and apparently they're not getting paid back quick enough for it to make sense for them.
That's correct. And what makes it even worse, George, is if you look at what's going to happen on January 1, 2010, the Centers for Medicare and Medicaid Services, CMS, which administers the Medicare program, they are actually proposing that the payment for the administration of chemotherapy, so I'm not talking about the drugs, I'm just talking about the service, will actually be cut by up to 38%. It's mind-boggling when you think about it. So that we're not only looking at a system now with Medicare that is broken, but come January 1, we're looking at a system that is going to severely negatively impact the delivery system for cancer in this country.
Now, most of the treatment is occurring on the community level. Am I correct to assume that?
That's correct. The interesting thing is that about 25 to 30 years ago, George, you basically had to, unless you were near an academic center, you had to travel some 100, 200, 300 miles. Now, you can get treated in your own community. That's important because people they can live as normal lives as can be getting cancer treatment and certainly have the support of their friends and family. So that's why roughly 4 out of 5 Americans are treated in their own community. But that's the system that has really come under a lot of stress, not just currently, but as I said, what's going to happen January 1, 2010.
That's chilling. Now, is there a legislative response to this problem? Are lawmakers on Capitol Hill interested in this problem, hearing you, and want to do something about it?
Well, there are a lot of lawmakers that are interested. We actually had 3 congressional offices that went with us, and us includes myself, a couple other people, and about 15 practice administrators from around the country. These are people who run cancer clinics. And we went up to, or went down from the hill, actually, to HHS and met with CMS people to not only provide them data that refutes what they're trying to do in terms of cutting, but we gave them specific examples of how people, average Americans, are going to be impacted if these cuts go through. So we have a number of people up on the hill that have their eyes open to this. The problem is that right now in the health care reform packages, we do not have enough provisions that will actually stop these cuts going into place January 1.